Let's go over some of the bony landmarks of this bone right here called the sternum. Now, the sternum is actually multiple bones that have fused together, but we'll get to that in just a second. So let's start all the way up here, and you can see that there's this notch here. We call this the jugular notch, which should make perfect sense to you considering the jugular vein is going to be in this region. Then there is another depression or notch right here called the clavicular notch. And again, that should make perfect sense as we can see the clavicle coming over and attaching to it. Now, this uppermost portion of the sternum is what we call the manubrium. Now, I like to think of the sternum looking very similar to a necktie. So this would be the knot of the necktie, but this upper portion is the manubrium. And then you can see a joint here. This is our first location of fusion. This is called the manubrio-sternal joint. And that is connecting the manubrium to this larger, in fact, it's the largest or at least the longest section of the sternum called the body of the sternum. So we have the manubrio-sternal joint. But the body here, I know it looks like one solid joint. This is actually multiple different segments. It's 4 different segments, and these will have fused completely by the age of 25. There will be some fusion that occurs in utero, and then there's some fusion that takes until you're 25 years to fully complete. But this sternum used to have what are called sternobri, and they were 4 different sections that have all fused together. Then we come down and we're going to first talk about this sharp tip. This sharp tip is called the xiphoid process. This is a cartilaginous contribution to the overall sternum, but xiphoid actually means sword. So this is the, I guess, the sharp tip, the sword-like sharp tip of the sternum. But then there is a joint here, and I know it kind of like, you can't really see it all that well, but this is what we call the xiphosternal joint. Right? So the xiphosternal joint is connecting the xiphoid process to the body of the sternum. And then the last thing I want to mention are what are called the costal notches. And you can't see them all that well because, well, the ribs are actually coming across and attaching and articulating with the sternum itself. But there would be like a depression here, depression here, depression here. Those are called the costal notches. And it kind of gives it like this serrated look if you're able to see a sternum without all the ribs. But that is going to be all of, well, not all, but the vast majority of the bony landmarks of the sternum.